in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting.
So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
Hey, my friends. Welcome to Tea with Dr. D. Happy Wednesday to everyone. Last Wednesday of October. So on Tea with Dr. D, we started this way back in 2020, so like 5 years ago. And it's my job to come on and answer as many questions as I can, as deep and thorough and helpfully as possible. So please drop a line, say hi, say hi, say hi, say hi. Let me know that you're here. Let me know that you can hear me. Right at the very top of the show, I want to mention a massive thank you to everyone who has already bought raffle tickets or donated to this Friday's Healing for Hope fundraiser. We are going to really make a massive push to raise a lot of money for cancer this Friday. If you don't know what I'm talking about, then you haven't been paying attention. No, I'm just kidding. For this coming Friday, every service that we do in the Hero Health Spa will be donated to raise money for cancer. So if somebody comes, does cryo, laser, infrared, sauna, if you've ever been interested or know someone interested in that, there's no better cause than right now to come and do one of those. We also have raffle tickets. We had some amazing sponsors to donate some incredible things. So come buy some raffle tickets. We're going to have lunch. We've got some really good desserts. We have Richard's Jambalaya. If you know, you know. We're going to have empanada guys serving empanadas. Everything is going to be phenomenal. We also have Noob 9 Coffee that will be out serving coffee. They'll be here at like 8 a.m., 7:30. Y'all come out, get your coffee. Make sure you come swing by. We are going to have an amazing day. We got a pumpkin patch. Bring the kids and take a picture. Somebody will watch them while you're doing your cryo session. I promise you. So we've already had a bunch of y'all who have signed up and donated. Thank you so much. This is a massive cause for me, for my family. I couldn't be grateful enough for the advancements in cancer. Over the last 20 years, we've seen just crazy advancements in cancer, and all of that is because of people who are donating and funding treatment and research and progression of diagnosis, early diagnosis. So come out. It's going to be a really fun day. We'll have a blast. So that is my thank you. Somebody asked what I was drinking. So this is Tea with Dr. D. Today I'm drinking a Japanese aged pu'er tea. Very good, high in antioxidants, good for you. And I think low in caffeine, although I haven't checked that in a while. I know it does have some caffeine, but it's not a ton. So I try and get on here every month. It's usually the last Tuesday or Wednesday of the month and answer any health questions that y'all have. You can text those to us if you have something that you are interested in hearing about or you're trying to learn more about. Random questions. We get this all the time. I kind of love it because I'm crazy like that. But you can send the text 801-691-7582 and that goes straight to me. I'm the one who answers if you get an answer. Or I might just use it for answering on this. So with that, Al, let's dive into a couple questions. Hey, Matt, what's going on, man? And El Bebe, welcome. I love your little profile picture. So, hey, how are y'all? I hope y'all are doing great. Donald, how are you, man? So if I weigh 160 pounds, roughly 75% of that number in protein intake, Is that daily or just on workout days? Okay, let me add some context to this for everybody. So I got this question from like 10 of y'all. And this was in response to my Sunday Thoughts email. Every Sunday I send out an email, just random thoughts. One of the studies that we highlighted in that took a study group, and basically while they were working out, they said, we want y'all to eat more protein. Specifically, they took them from 1.2 grams per kilogram to 1.6. For those of y'all, that is about 0.7 grams per pound. So 3/4 of your weight in pounds, they were eating that many grams of protein. And what they found was crazy. The study group that ate more protein, 75% of their weight, added 27% more muscle mass, almost a third more muscle mass, and 10% more strength. Doing all the same work, all they did was have this higher protein intake. So this is really important if we are trying to build muscle. It shows us that we can do all the same work. We can work the same intensity in the gym. If you don't have the raw materials to build more muscle, you're not going to build more muscle. So we use this as a metric, and especially if you're healing from something. People don't think about this, but like if I injure my shoulder and I'm trying to rebuild strength in that, that is the perfect time to make it so easy for my body to lay down more muscle by eating more protein. So this was a great study because it gives us a target. 75% of your weight in grams of protein gives you 27% more muscle mass and 10% more strength, even if you're doing the same work. So this is, to answer this question, yes, this is every day. We're trying, your body's not just building muscle on the day you work out, right? The day that you recover, the next day, your body's still going through this building process. So make sure if you're in this building phase that you are increasing your protein intake until you achieve that goal. So that might be something that you're doing for 3 months while you're really working on rebuilding strength of a shoulder or a back or a hip, whatever that might be. When we look at muscle protein synthesis, that keeps going for about 48 hours. So that's why we say make sure that you're still recovering well, you're sleeping really well, and you're getting protein on top of what the work is. So, the exercise, you got to put the exercise in, but make sure that we are recovering that stuff as well as we can in between workouts. Get your protein, get your rest, all of these things. But make your daily protein intake that 75%. If you're in a muscle building, make sure that's your baseline and try to hit that number. I've told many people, if you hit your protein number and you hit your fiber number, everything else in your diet is probably okay. If you hit those two numbers, everything else will take care of itself. So small tip for you if you're trying to make sure that you're optimizing your diet for health. So hope that helps and clears any of that stuff up. Let me know if y'all have any questions there. Hey, Matt, thanks for the comment, man. I appreciate it. I hope you're doing really well. This cold front's got to be having you a bit excited to get out and, maybe see if some animals are moving around. Does laser therapy have a positive impact on arthritis, particularly in the foot? So when we look at laser therapy on arthritis, what we see in studies and anecdotally, so I get to talk to a ton of clinics that are using some version of advanced therapies, regenerative therapies, laser therapy for sure. And what we do see is that the inflammation that arthritis often causes is very, very positively impacted with laser. When we look at actually regrowing cartilage, and I'm this is honest, if somebody's telling y'all this, we don't see that laser or really anything else is regrowing cartilage in arthritis. So if somebody has severely degenerated joint, we won't see that laser therapy has regrown the cartilage, but it will help reduce the inflammation in that joint. If we stack it with other therapies like peptide therapies, or certainly on arthritis, we want people getting like MSM in. We want people doing collagen. We often want people doing glucosamine and chondroitin. So like that whole picture. We can see that the fluid in an arthritic joint gets more robust and improves significantly the mobility of that joint. And when we see that, it often is one of those things where somebody says like, I don't have any more pain and everything is working well, but I still have arthritis. And that's what the studies show, is like, you may not get to a point where if we did an MRI of that joint, that it says the arthritis is gone. Like the joint looks like it's a new young joint again, but we don't even see that in stem cells, to be honest with you. But we will see that the mobility is back. The joint spacing is improved some because we're holding more fluid in that joint, and the pain is gone. So that's where, like, you know, depending on how far along arthritis is, if we can address it very early, we have a much better chance of capitalizing on the healthy cells in the joint. The more those cells get damaged, it's really tough for us to see cells regrow, certainly like inside of a joint. We haven't seen that in many things. Who knows what the next decade shows, but the best results I've seen for laser is when we stack it with multiple joint health supplements. Of course, proper treatment to make sure that all the muscles that cross that joint are functioning well. And then we're doing some version of like regenerative agents. We use peptides a lot in our office. And when you stack that with a laser therapy, you can see some crazy results inside of an arthritic joint. We've seen some really good changes in knee arthritis, ankle arthritis, arthritis mainly of the hip. I've seen a hip go from barely being able to move to like somebody sitting there doing windmills. And that's just because the laser we have can get 5.5 to 6 inches deep. That's not every laser. There's some lasers that don't penetrate that deep, but if you get one that can, they can really do some really good stuff. So, yep. Hope that helps. Be nice if it was like, oh, just do the one thing and it'll fix it all. I know we all like that. Let's see, Beth, I have a meniscus tear. What are my options for treatment? Do I have to have surgery? Thank you for the question. The short answer is no. Certainly, if it's only a meniscus, we don't have to have surgery. Treatment kind of depends on the tear type. Of course, the severity of it, and then what your goals are too. Like, you know, if I have somebody who's like, hey, I'm 65, I like to walk, I don't do a bunch of super high intense or like plyometric exercises, then we almost would never recommend surgery in that case. Now, if I have a 40-year-old who's like, I love working out, I like running, I like hiking, I want to go skiing, then we're going to get much more nuanced of where do we need to go. The tear type matters. So like there's 2 zones in the meniscus, these like avascular zones that don't get a lot of blood flow, and then the vascular zones closer to the middle. Things like complex tears, flap tears, when the tear is flapped over, you have to get those cleaned up because the body has a really tough time folding the flap down and kind of like healing it back together. So flap tears typically need some form of a surgical intervention, even if it's just cleaning. There was a good study done in like 2013 that found that there was no difference in outcomes between people who had arthroscopic meniscectomies. So they cleaned out that. And then when they went in and they just faked the surgery and did rehab, there was no difference between the 2 groups. So we really can heal a meniscus much better than we think. Going back to Matt's question, if you do a bunch of these things inside the joint, we did a study maybe 2 years ago on confirmed meniscus tears, non-flap tears though. No one had a flap tear. And we had them fill out a full knee questionnaire of what things they couldn't do. They got treatment, they got needling, they got laser therapy and peptides. And at the end of 2 months, it was a 3-month study, but at the end of 2 months, 8 of the 10 participants in this had maxed out the improvement that questionnaire could show, which is really good results. It was like incredible to see how fast they changed. So there's a lot of options for that. Like if you're doing, peptide, laser, PRP, stem cell is an option for people. And it really does show us in these situations, if we can take it slow is another part of this. We can heal a meniscus in a lot of cases. To heal it, you got to take it very easy in the beginning, though, because we can't go back in and re-injure that torn meniscus. If you go in and you get it cleaned up or you get it kind of stitched back, now we can get there faster, if you will. The early stages are quicker, but the late stages might be a little more challenging. So it's definitely one of those that we've got to make this decision case by case. To go back to your question, though, you certainly don't have to have surgery. And many of our patients have gotten back to very high level activities without surgery by using this stacked approach. If you're looking at this or you're watching this and you're not around us, you need some regenerative options if you really want to heal this well. When you get to your rehab focus, we need your quad to be crazy strong. We need your hamstrings to be stronger than they've ever been. And then you really want your hip to be very stable. If we're missing stability at the hip, it affects the knee. So that's our focus when we're in like the training part of it. And if you can improve those things, you can offload the meniscus or at least keep it kind of balanced so that we're not irritating those forces by irritating the meniscus by imbalanced forces into the knee. So don't rush when you're making this decision. Get a couple options. If you have a really good regenerative therapy plan, I've seen very high level healing happen. If it's too bad off, trust your doctors. If they don't think that it's possible for it to heal, they certainly make sure it's somebody that you trust, but have those conversations and make sure that you are getting in the right hands, let's say. But it can definitely heal, and there's been times where we don't need surgery. Hey, El Bebe, what would you recommend in your practice for someone who is under extreme mental stress? I would say make sure that we have somebody to talk to. I think we are in a situation nowadays with more and more access to good therapy, even if that is doing like, Zooms, like where you don't even have to go somewhere. I think it's one of those situations where you cannot overlook that. As we get deeper, when we're looking at mental stress, I always want people to have a good idea of what's happening inside their body. So make sure that we have all the right building blocks to produce proper hormones, to produce proper functioning inside the nervous system. That's where these things are going to come. I did a really, really good podcast a while back on the dual stellate ganglia reset. So dual stellate ganglia reset. And that's basically a system where they go in and they inject basically an anesthetic over the stellate ganglia and the cervical nucleus. And the results they were seeing after that on PTSD and stress were incredible. So Google that. It's a really good episode that talks about how we can get stuck in these extreme stressful situations, not only mentally, but there's a physical cause to it that can be addressed, that we can go in and like turn off this physical response to keep us in this fight or flight or stressed or PTSD kind of loop that happens for so many people. The other thing we tell everyone from like a mental health and stress standpoint is like, don't think that the basics are not going to help you. I've seen so many people who started like trying to eat better, trying to sleep better, get outside and get some sun, make sure that they are hydrating, And like these small habits, exercise, exercise, exercise. The more you exercise, the better you're going to be. Exercise has been shown to be better than many medications. So doing those small things is not going to create a small result. If you do a few of these little habits and you do them consistently, that's been shown to be one of the best things that we can do for mental stress. So that's A, do that. B, make sure you get to where you can talk with someone consistently. Find somebody really good who you trust and believe in, and start working through these issues that are kind of triggering some of the stress response. I know it can feel like it's one of these like just kind of massive gorillas to get off our back, but I've seen people come out of this on the other side, and then look at some of the more advanced stuff. Look at dual stellate ganglia reset. Look at vagus nerve treatments. There's some really good things that are on the horizon for stress, for anxiety, for PTSD. So I hope that helps. Let us know if you need any contacts. We work with some incredible mental health specialists in the area. Kaylee, nerve pain behind my shoulder blade, help. I'm not laughing at you. I hear the need in your message. Okay, so behind the shoulder, we see this a lot today, and most of that's because we are sitting. I'm gonna try and show y'all something. Tell me if this looks really weird. Give me 7 seconds. So there's a nerve that comes behind your shoulder called your dorsal scapular nerve. Okay, I don't know if this is gonna work. For those of y'all who are watching this, there's a nerve that comes from your neck that runs through the back of the shoulder and down inside your shoulder blade. Look up the dorsal scapular nerve if you're just listening to this. When we get really tight in our like neck or chest, that nerve gets pinched in between the muscles that attach to your shoulder blade and the ribs. It comes from like C5, so we can get some compression in the neck. So in our office, we're always like, are we getting compression at the neck at this like C5 nerve root that contributes to the dorsal scapular nerve? Or is it getting compressed in the shoulder itself because the muscles are too tight in the front and they're actually kind of pulling tension across that nerve and restricting its motion? What can we do for that? We can do a bunch of things. If it's coming from that pressure, we actually release all the tension that is along that nerve path. Now, some of that is where we're releasing tension in the chest to get the shoulders back, so I'm not just smashing that nerve. Seems a little weird if somebody comes in and they're like, my pain's back here, and we start loosening up the other side. But the reason is I can loosen all those trigger points in the back and try and get the ribs moving. But if I can't get that shoulder blade back in a good position, so the shoulder blade's not pressing on the nerve, we're not going to create long-term healing. So something like that is like address the whole system. Dry needling can be a very big help. So Kaylee, I'm not sure where you're at, but if you are somewhere where you can find a really good dry needling practitioner, I would start there because that's going to be the fastest way to make this change. Manual therapy, like if you go somewhere and somebody is not putting their hands on you, go somewhere else. This is not a problem that I see someone exercise their way out of. Love it. We need to train. We need to get the body in balance at the right time. This is not the time, like while that nerve is irritated and aggravated, it's not the time that stretching and exercise is gonna work. We need to treat the problem so that you can get back to the exercise stuff. When we're looking at nerves and neuropathy, we talked a little bit about laser therapy. Laser therapy shows good results in nerve conduction and inflammation. We talked a while back on this about PEA, palmitoyl ethanolamide, for those of y'all who remember. That's why we call it PEA. PEA acts really, really strongly to reduce inflammation in a nerve. I would start taking that. We use a company called Mirica, Mirica. Love what they do. The nice thing about PEA when it comes to nerve inflammation is that it reduces swelling quite quickly in the nerve. Within like 2 to 3 weeks, many people see very, very big improvements, and they've done studies on severe carpal tunnel, severe sciatica. So PEA is a really easy place for you to start, and then make sure you're getting some treatment. If it's that bad, this isn't even one of those things that I would say like give you a stretch or something. Go and get somebody who's going to release some tension off of you and get pressure off of that nerve, so that we can get some blood flow and healing agents into it. So without making this a complete boring, nerdy, anatomical treatment talk, unless y'all want to hear that, let me know. Make sure you get it assessed. Is it coming from the neck? Is it coming from the dorsal scapular nerve? Is that happening from a muscle standpoint? Do you have a muscle imbalance? Or is that a joint compression issue? And if you find a good doctor, a good PT, a good DO, even probably a good chiropractor, if they're looking at that stuff, they'll be able to kind of work through all of those things for you. And then once you get the pain gone, you're probably going to want to be looking at like posture. What position am I holding my body in all day? And do I need to work on that? Do I need to do some exercises or change some of that? So hopefully that helps, Kaylee. Let me know if that doesn't make any sense. You can ask any questions you want, Heather. Welcome. Let's see. What kinds of exercise do you recommend to help cardiovascular health post shoulder surgery? So my easiest answer for this is sauna. Sauna is like the exercise trick. If we are coming off of a surgery, there's been multiple studies that show the heat from sauna tricks our body into thinking we are exercising. The heat heats up our blood, heats up our muscles. That turns on these heat shock proteins, that increases some growth hormone. They did a study on people who had, I think it was elbow surgery. Don't quote me on that, and they were in a cast, so they weren't able to really exercise it at all. In one group, they were doing sauna, I think 3 times a week, and the other group was just doing like the typical medical management. When they looked at them at the end of 6 weeks, the group that was doing sauna had only lost 5% of their muscle mass. So they kind of really, in that sense, were able to maintain the muscle mass in there at a very high degree. The group that was not doing that had lost, like, I want to say it was like 30 to 40% of their muscle mass. So the sauna group maintained almost everything. And they're not exercising. They're just sitting in the sauna. So that's a great place to do kind of 2 birds, 1 stone, right? We're getting some cardiovascular health. The studies on sauna shows if we're doing sauna a few times a week, we reduce our risk of all causes of cardiovascular disease by about 25%. If we do sauna 4 times a week, we're reducing it by 50%. This is all causes of cardiovascular disease. So really big study done on that if we have a cardiovascular issue, we want to start slowly and build up our tolerance of sauna. So that's step 1. I would say that's like a very easy one to do, because we're not going to do really any, negatives based on some of that stuff. The other thing is that, like, we use this, and you've probably seen it. We use Katsu in our office because it's an easy way for us to start getting growth hormone without doing a ton of exercise. So I had a woman a while back who couldn't hardly move her shoulder after that. And we would just put the Katsu cuffs on and just let it run a Katsu cycle. So it turns on and off, on and off. And within a matter of weeks, she's like, my shoulder feels dramatically better. And that's again, it's kind of a trick. We're not really doing exercise. She's just sitting there tricking the body to respond. And all of these things act as a bridge to get someone towards being able to exercise it. We're going to have to, right? We're going to have to load the tissue. We're going to have to start, like, walking is a great thing for cardiovascular health. Biking, cycling, pedaling, like any of these little small things that we can start rebuilding stuff. I would say at the at the early stage, it's like, what can I do that's easy? Can I walk? Like walking's underrated. We keep seeing studies on walking that are like, they do such a good job of increasing lifespan, reducing, vascular issues, improving mental health, going back to some of that stuff. That would be like the low hanging fruit. Start doing some katsu on the shoulder. Try and get some heat going, get in a sauna a couple times a week, even if that's like I'm doing a sauna a few times a week and I'm doing like a hot bath a couple times a week, and I'm just trying to get it. The studies on sauna were done. It's 25 minutes is what most of those studies were done. They're in there for like 20 to 25 minutes. I get that question a lot. So those are easy ways to kind of get that started. And at least get things back on the right track. Same thing that I was saying earlier. I think anytime we get in these like health spirals, we think that the basics are too small. When in reality, if we can pick 2 or 3 small health habits that we can do, hydration, taking a walk, reducing something like sugar, and that's our only 3 things. We're like, I can't do anything else, but we do that consistently. The compounding effect of starting to give my body good things is so big. It can be incredible to just get started. I call these health multipliers. It's like, what's this tiny habit that, because I repeat it every day and it starts to create effects throughout my body, it multiplies and causes these crazy big effects. I love those things. Don't think that any of those are too small for you. Anything that you can do that's better tomorrow than what you were doing today is going to start to create this multiplying effect, this compounding effect, and start getting health on the right track. So you can do it. You can do it. I promise. This is a miracle drug, spinal injury. Oh, this was about PEA. Yes, I love it. PEA, especially if we're dealing with any nerve stuff, it can be really, really helpful. We actually get it compounded in some of the peptides that we use. And that's because it creates a really big response in the nervous system, acts as a great antioxidant. PEA is interesting. I'm going to nerd out on y'all for a second. PEA, it works as part of the endocannabinoid system. So like the same place you hear everybody talking about CBD and THC and how that affects the nerve health with inflammation. That's where PEA works. It goes and attaches to that receptor in that same line to reduce nerve inflammation. It modifies the mast cell response, like the big pain response that we get. There's been some incredible studies on PEA, especially with nerve pain. It's one of those, y'all hear me probably talk about it a lot because no one knows about this thing, or at least I haven't heard many doctors talk about it. And the studies just keep stacking up where it's like that being compared to placebo for nerve pain, and it just blows it out of the water. So very, very good, very helpful, Yvette. I'm glad you got some good results from using that. Most of ours, it's like 300 to 1200 milligrams per day. Kind of depends on how bad the pain is and how long it's been there. But yeah, I love PEA. Y'all probably hear of it again. If you have nerve pain, take it, try it. Very low hanging fruit, very minimal side effects. Great for mental health. There's been some studies of it on like mindset and brain health, brain function, inflammation through there. So, yep, good all around little compound. Does dry needling get rid of old chronic trigger points and tightness? I think dry needling can. Dry needling does a really good job of reducing trigger points because it goes in and it addresses like the electrical signal. So one of the reasons we think trigger points get created is because the nerve and the muscle aren't communicating correctly. And that creates this kind of overactive muscle fiber in there that stays tight. So it creates an energy crisis. It think of the muscle kinking its own blood supply. It's like pinching the hose that's meant to feed it. This creates inflammation and kind of sets off this negative cascade where like my muscle guards even more because it's hurting and inflamed. So what does it do? It tightens and cuts off more blood flow and we get stuck. When we get that twitch response, if y'all are listening to this and you've ever felt like that muscle poof and let go, that is where the needle is releasing all of that electrical energy in the muscle to reset the tone and get rid of the trigger point. I do think that it can help improve microcirculation. It reduces inflammation and we can get the electrical signaling back. There are times where I think we also still need someone to get in and loosen up the fascia covering the muscle and any attachments between multiple muscles. We see trigger points where the body is almost protecting emotion. And if we don't get in there and kind of do some hands-on and some loosening to make sure all the muscles glide and the fascia glides, then we'll see trigger points come back. So people will call our office and say, can I get dry needling? It's always part of a full treatment program of let's make sure we're addressing the nerve in that situation, addressing the muscle, addressing the joint that's around it, addressing the fascia involved, and addressing the blood flow that needs to help bring all these healing agents to the area. So just dry needling alone, I think you're only addressing one part of that whole picture. So same thing, like if you're not getting hands-on stuff, if you're not getting treatment that involves more than somebody who's just doing dry needling, I think you need more to truly get rid of chronic trigger points. If it's like you woke up and you got a crick in your neck and it's 2 days old, yeah, maybe we can do a needle and release it and it goes away and it's gone because we haven't brought all those other systems on. But dry needling is awesome, stimulates healing. It addresses a lot in there. And there's been multiple randomized controlled trials that show that if we do dry needling, it does help. I will tell you, almost every study I've ever seen on dry needling shows that if you add other things to it, exercise, manual therapy, other modalities, massage, that it makes the dry needling more effective. So that goes back to what I was saying earlier, like, address all the systems involved and you will see much, much better results. So, but it does for sure can be a really effective tool in treating chronic tightness, muscle tone, like hypertonic muscles that just won't relax, trigger points for sure, where you got kind of knots in the muscles. But I think in all those cases, make sure you're getting kind of a full range of treatment. So, love it. Thank y'all so much. Cancer fundraiser this Friday. You are right. You are right. You are right. I'm very excited. Please come out, tell your friends, invite friends. We have a Facebook event. We'll throw it in the stream comments at some point this afternoon. But please come out, get lunch, come get coffee, get breakfast, come bring a friend and get a service done. Come buy some raffle tickets. We have some awesome raffle prizes that the incredible community around Acadiana has donated. So we've got some really exciting things. So you can actually like win something great while you are doing something great and giving back to this community. And we know how much we are affected around here. I don't know a single person in my life who hasn't been affected by cancer. So I think the more we can do to keep raising money, funding research, funding treatment for all of our local families and friends, it's a good thing. This is nothing but positive. So thank y'all. I hope to see y'all on Friday. And remember, like tomorrow, do like one little thing to get a little bit healthier. All right, everybody. Have a good evening.